All right. Welcome. Nice to see everybody. I'm gonna get cinnamon all over myself here. That's not good. Hello, hello. Who do we have in the room? Drop us a note to say hi. Hey, Alyssa. Hi, Celia and Olga. Hey, Andrew. Hey, Megan. Hey, Craig. Hi, Fern. We're in good company. Hey, Allison and Kieran. And oh, now you guys are going too fast. Oh, hey, Aaron. Nice to see you. Awesome. Hey, Jenny. No, we can't hear you. Fern. Awesome. Waterloo. Kawartha Lakes Public Library. Awesome. Hey, Katie. All right, let's give everyone 2 more minutes and we'll kick this thing off. Thanks for joining us. Hey, Constance. Cool. We got some Ontario. We've got some non-Ontario. Awesome. Cool. Let's start. So we have people from all across the country today, and thank you for joining us. We're going to take a little bit of time up front and throughout the presentation to explain the Ontario context, but I think it's worth mentioning that the Ontario context, although it looks a little bit different, is not dissimilar in regards to how homelessness is growing and changing and escalating, and how governments are responding to it, particularly between federal governments, provincial governments, and municipalities. So looking forward to kind of our question period later and hearing in to what regards the situation in Ontario, which we'll talk about today, is parallel, similar, or dissimilar to what you're seeing in your communities as well. So for those who don't know why you're here, we are going through the Municipalities Under Pressure 1 year report, 1 year later report, which was an update to a report we did with our partners AMO, NOSDA, and AMSA. They're in the room today. That looked at provincial estimates of homelessness across Ontario through participation with 47 of the Ontario service managers. So I'm going to go backwards before I go forwards, talk a little bit about the previous report and why we did it. And Michael from AMO is here to support. And then we'll talk about the newer results. Maybe get these slides working. Okay. First, I know it looks like there's Ontario service managers in the room. Just wanted to always start this by kind of gratitude for participation, and it's a huge lift. And gratitude for participation of people who share their data in hopes of improving their outcomes. And really, this report is only useful insofar that it's improving outcomes. Also wanted to thank AMO, AMSA, and NOSDA for trusting HelpSeeker to do this work again. For those who are not from Ontario, they're really important associations that represent the interests of not only municipalities and collaboration with provincial government, but also the service managers who are in charge of the social service system here in Ontario. What we're going to chat about today is what has changed since last year, the scale and growth of homelessness, where we're sort of seeing pressures concentrate, a little bit about community housing. Do want to talk about spending and then projections. So we've updated our economic projections to 2035 under kind of the new economic scenario that we're in. And then also, that's a typo on the bottom. At the end of this, want to have a kind of a broader discussion about sort of my perspective, opinion on where social infrastructure is going and where it needs to go. Okay, so to level set on last year, you'll notice this is 1 year later. So where were we in January 2025? We did the first report, and that was with all 47 service managers. And we collected data from 2016 to 2024 on a range of kind of data points. So there was over 1,000 data points for every service manager. We looked at spending for homelessness, funding, we looked at wait lists, percentage of youth experiencing chronic homelessness, and then overall, we looked at the numbers of experiencing homelessness. The intent of that was really there was conflicting baselines of how many people were experiencing homelessness across the province. And so really wanted to come up with a new, more modern baseline of how many people might be experiencing homelessness throughout the year. At that time, we estimated 81,515 people throughout the year experiencing homelessness. The 2024 figure, excuse me, was an estimate. So we stopped data collection in September. So we had to estimate till the end of the year. But that was sort of the estimate for the current number of people experiencing homelessness. Importantly, too, we found that chronic homelessness was half of all people experiencing homelessness. So indications that more and more people were getting stuck in the homelessness response system. And in that report, we also found under 3 economic scenarios, we modeled what homelessness would be from now until 2035, and that it would be 160 predicted, estimated 160,000 if we were to have a steady economic situation over the next 10 years, which we are not. And then worst case, up to 3,000 people experiencing homelessness in 2035. Before I go any further, I'll turn it to Michael, who's here from AMO, to talk a little bit about the context for doing these reports and how it's impacted some of their work.
Great. Thanks, Jesse. Thanks for the opportunity, and thank you to Jesse and the Help Seeker team for working with AMO and partners on this project. For those that are not that familiar, I'm just going to talk a little bit about our association, why we cared about this research, the driver, and why we partnered with certain organizations to do this. So just very briefly, the Association of Municipalities of Ontario represents Ontario's 444 municipalities, and we work together to meet shared goals and common objectives. Housing and homelessness are a big challenge that we seek to address. The reason why municipalities care so much about this research on homelessness in Ontario is that, like other areas in the province, municipalities, community partners are clearly on the front lines of the homelessness crisis and the housing affordability crisis. In Ontario, for those not from this province, we're a little different from other provinces and territories. Jesse has referred to the municipal service managers, and we do have 47 municipal service managers, including municipalities and boards called District Social Service Administration boards that are responsible for homelessness services and housing services, both legislatively and through funding agreements with the province and the federal government. The driver for the original research was really about the need to have data in the face of an escalating crisis to aid evidence-informed public policy development and advocacy. We did not have a profile of homelessness, either the current or the future state, and there wasn't really a comprehensive assessment of need, an identification of the solutions required, or cost estimates of what it would take to address the problem. To that, we turned to Help Seeker in their original report, which had a fairly significant impact and was very comprehensive. As Jesse's mentioned, there's 3 municipal associations involved in this research. So in addition to AMO, it was the Ontario Municipal Social Services Association and the Northern Ontario Service Deliverers Association. And we partnered with Help Seeker, who obviously had the knowledge, the expertise, and the tools to undertake this research. And as Jesse mentioned, all 47 municipal service managers participated in a heavy lift with their data submissions. It was a real tremendous effort that was driven by the commitment to the outcomes of the project. Now, just getting to the update for the reason for the webinar today, we just felt it was important to take stock 1 year later, really to assess progress and to be able to sustain an evidence-informed dialogue with the government and with other sector partners. So for that, we turn to Help Seeker once again for their assistance to do this second phase of the research. We wish the results were better, but it clearly demonstrates the need for action. So with that, I'll turn it back to Jesse.
Thanks, Michael. Okay, in that report, we'll still do previous report here for a minute, is we looked at we modeled two investment scenarios, and I bring these forward because these haven't changed in the update. Ultimately, we see homelessness increasing in the update, which I'll show you, and the need for investment in deeply affordable, supportive housing, appropriate housing remains, as well as prevention. So as a recap, we looked at two scenarios in the previous report. One was the what can we do if we had 2 billion? And really this was designed as a shock to the system. How can we improve community well-being, improve community safety, family well-being by targeting where pressures are most acute? And of course, huge attention on unsheltered homelessness, encampments, and preventable loss of human life. So in that scenario, we had about 5,700 net new spaces modeled and roughly 8,400 people, which to stabilize roughly 8,400 people. And we use the Help Seeker homelessness modeling tool, which looks at how many spaces and what combination and what cost is needed to reduce or end homelessness. And I know some of you on this call use this same tool locally. So first scenario was 2 billion. The second one was 11 billion. So that's your full package. That's your integrated housing and homelessness supports. That's prevention dollars to ensure that people can remain housed, which we know is the most cost-effective solution. That's deeply affordable housing. That's supportive housing for people with higher acuity needs, prevention, diversion, and housing stability. So that recommendation still remains, and you'll see that throughout the report. One of the aspects of doing this is in part to look from the perspective of municipalities. And although Ontario is unique in the structure, it actually isn't happening in other places across the country. And so in the 1990s, just a quick history lesson, 1990s, federal government withdrew from social housing, really ending new funding. At that time, then Ontario devolved responsibility in mostly in 2000 and 2001, making service managers responsible for housing and flowing funding through service managers um, under the Housing Services Act, so a legislated mandated responsibility. Under that Housing Services Act, municipalities administer social housing programs, maintain the wait lists for RGI units, fund housing providers, deliver homelessness programs. They're also responsible for creating and updating housing and homelessness plans, which have quite a large breadth of responsibility in themselves. Some might argue beyond the mandate of a municipality. So a lot of responsibility sits with municipality. Though that's different, the shifting of responsibility for homelessness and housing and other social infrastructure between levels of government isn't different. So we have formal downloading or formal change of mandates for social infrastructure. That's when there's legislation like the Housing Services Act. It says this body is responsible. But every day, provincial and federal governments make informal decisions within social safety net decisions. So withdrawing funding, changing program rules, creating new expectations for reporting, those actually are what I would argue micro shifts in mandates. And what we're seeing across the country when I did a review of each of the provinces is that there's actually quite a bit of that happening. And so it indicates to me that social infrastructure is still a hot potato, and there's a wrestling between each level of government of who it sits with and how, and it extends far beyond homelessness. But we're gonna go back to that near the end of this. Okay, you want to see the results? Let's see the results. Oh no, I have to do method. Quick overview. We collected a smaller number of fields this year, so if you're saying, oh, where is that information? It means we didn't collect it. We largely published everything we had. Because we collected later in the year this year, our data collection ended near November. We feel really strongly about the accuracy of our 2025 numbers. Although when we projected homelessness in 2024 at 81,000, the actual year to date was 78. So actually we were within a 3% estimation when we did our projections. One of the things we wanted to do in this report too is acknowledge that we're in a broadly different socioeconomic state than previously. And so we ran a new scenario to reflect some of the anticipated impacts of what we're seeing in the South and tariffs and unfortunately huge job losses in certain sectors. And the final thing we did a little bit differently is we wanted to get at encampments differently. So we had tried in the previous year to look at encampment numbers, and it was challenging. How it's measured, is it tent, is it a person? When it's measured was all very different. So we updated our methodology, and I think have a clearer point in time snapshot of encampments in the province right now. Okay, now we can get into the results. So unfortunately, what we see is estimated homelessness for 2025 is nearly 85,000. So 84,973. We can see the year to date, we adjusted to 78,802, which again was within 3% of what we had previously projected. So pretty chuffed about that. It's a 7.8% increase, which, as Michael said, is not good news in any sort of circumstance. What we can see now with 5 years of COVID data, I'll just point you. Can I draw on this? Let's try this. This should be fun. Yeah, okay, cool. So now we have our 5 years of COVID data here. And what we can see is actual relative stability from 2018 to 2021. So not to say the homelessness is not an issue, that's not impacting families, but we really can see that this post-COVID or during COVID increase is persistent. So while we can see in the media, public discourse, political rhetoric we often hear about social issues getting worse. They're never as bad. It's never been this bad. It's the worst it's ever been. Oftentimes that's rhetoric and that's not backed by data. But what this does present is a real increase backed by data, which of course is impacting communities and families and those working to address the issue. Let's see if these drawings go away when I do my next slide. Oh dear. How do I get rid of this? Okay, awesome. So we also wanted to look at encampments. In Ontario, there was a significant investment portfolio for heart hubs. You hear them as heart hubs, so homeless and addiction recovery treatment hubs, excuse me, which was intended in part to promote recovery, but also address some of the unsheltered, more challenging experiences of homeless people had when dealing with concurrent substance use and mental health. What we also saw is changes to laws around the enforcement of encampments and several judgments, court judgments on when you can and can't dismantle encampments. Difficult to count encampments, but through this methodology, we found that actually most encampments are smaller in size. So nearly all service managers, I think all but one, reported encampments, or more than two, excuse me. And then most were between 6 and 10. You've got a fair amount between that 11 and 20. What we see as far as large sort of media depictions of encampments, far, far fewer. In the results, we asked service managers to comment just on the nature of how encampments have been changing over the last year or so. And different perspectives, but consistent perspective was encampment enforcement was more shifting the location of where people are and impacting the size, so breaking them up, less so resolving, of course, resolving homelessness writ large, which is an important finding in itself. So encampments were more likely to go to forested areas or places where people in encampments, excuse me, forested areas rather than in more visible spots, say in downtown. And excuse me, we estimated about 2,000 site-based encampments were identified. So what we asked is, how many encampments do you have now? And so that was a point in time, not throughout the year. The only demographic information we collected this year was Indigenous homelessness, and I had indicated in the previous year that I felt it was an undercount. I still feel it's an undercount, but what we do see is an increase in Indigenous homelessness. Some of that may be due to better data collection, but overall, I believe it's an increase that's growing disproportionately to the rate of homelessness overall. We again looked at chronic homelessness, so people who are homeless for an extended period of time. Mostly communities use the federal definition, some use the provincial. Doesn't really matter for this exercise. Last year, or in the last report, we had indicated that homelessness was about half, or chronic homelessness was about half. So it indicates to us that more and more people are getting stuck in the system. And again, let's draw on this again, a similar pathway or a similar, sorry, trend, excuse me, from this 2018 to 2021. So as you can see here, it's holding out at around 25%, not quite 30% here. Here, this is where we start to see. So not only are we seeing homelessness increase, but we're also seeing the proportion of people experiencing chronic homelessness increase. This is in part driven by immigration and systems responding to refugees, but we would be fools to think that's the only thing, which is sort of popular rhetoric that's challenging in this sector. And so we can see now it's increasing half. So too many people going out, too few, going in, too few leaving the system, which puts incredible strain and creates cost within the emergency serving system. Okay, clear that. Northern homelessness, similar to last year, what we see is a more rapid increase of homelessness in the north. So 37.3% increase and huge pressure there. What to me, this is frankly a cautionary tale. What happens if you have no infrastructure? And so across the province and in other provinces and communities, we say we're continuously building, we're spending, and it doesn't seem to be getting better. Well, actually, we're probably curbing the increase or curbing the trend, because when we don't have infrastructure, which there's a lack of in northern communities, then this increase happens tenfold. This is actually one of two reports we released in January, and Fern from NASDA is on the call. We did a second report with NASDA and CMHA Ontario that looked specifically at the north, and we looked at the need to integrate not just housing supports and housing investments, but also health investments, specifically mental health and substance use. What we found in that report is alongside this 37.3% increase, mental health and substance use emergency department rates were 4 times out of the province. And actually, we're seeing a bit of a stabilization in provincial figures. Not to say it's not still a crisis, but stabilization of mental health and substance use, ED visits, and preventable deaths, while the growth in the north is pulling away. So we have this escalating situation of increasing homelessness at the same time of increasing mental health and substance use issues with a lack of infrastructure, all at the same time of planned economic investment. So we're depending on a region for economic productivity without some of the key infrastructure pillars to do so. And we'll send you after this webinar both reports, the Municipalities Under Pressure and the separate Northern report. So looked at rural communities. So communities were able to select whether they were mostly rural, mostly urban, rural-urban mix. We saw an increase of 31% of communities who identified as rural. Again, similar with the exception of 23, 24, which is sort of interesting here. We don't know the cause of that, but we see a similar increase. Let's draw again. Similar increase 2021 to 2025 here. So similar to my point to the north is when we have no infrastructure at all, the compounding conditions that are contributing to homelessness happen at an escalated rate. Okay. We also looked at wait list numbers because I think it helps us contextualize chronic homelessness. Not that everyone exits into community housing or deeply affordable housing, but what we have is an estimated 301,340 people, households, excuse me, on the wait list for community housing with an average, wait time of 65 months. So in some communities, we have some households waiting more than 16 years, which is incredible, unfortunately. And then exit capacity is really not keeping pace with the inflow, which is why then we see increases in chronic homelessness. So similarly here, you're going to get sick of this. You don't need my drawings anymore. However, we see relative stabilization, and now we're seeing this upswing. And you can have, double counting of wait lists, et cetera, et cetera. The point is when we look at these trends, 5 years trends, there is a pre-COVID and there is a post-COVID trend line. One of the important aspects of the first report that we carried through to the second report is looking at funding and expenditure, not only by level of government, but what we're funding. So what we see is over 4 billion of funding in housing and homeless or housing and homelessness funding in 2025 across all levels of government. Municipalities account for approximately 2 billion of that total, so half of all the housing and homelessness funding in the province. However, not all funding flows through municipalities. So hard hubs, for example, does not go to the service managers. There are other investments in housing and homelessness that are not represented here. But for the case of kind of this discussion, municipalities are accounting for half of that contribution. And when we go back to the conversation about mandates and legislative responsibility, this isn't just happening in Ontario. There are municipalities in other provinces without a Housing Services Act that dictates they have responsibility for this that are contributing significant and increasing dollars to housing and homelessness. So municipal funding increased from 1.1 billion in 2018 to 2 billion in 2025, which is a 90% increase. And of course, I'm not going to draw my lines, but you can see this increase in 2021 for housing. And again, it's a places that we're seeing this sort of pattern elsewhere as well, but hasn't been as clearly documented, but could. This I found really interesting. So when we look at the homelessness spending of where it's actually going, when we look at the historical data for emergency shelters, it makes sense. Emergency shelter spending is the greatest expenditure within homelessness historically. And so it increased slightly from 1 billion to 1.1 billion between 2024 and 2025. It's still the largest expenditure, but the proportion of spending proportion of spending is declining. So in 2023, it was 66.7% of the expenditures to 50.5%. Where we see that growth happening, where is that kind of proportion going? We're seeing an increase in supportive housing from 540.8 million to 578.7. So now it's representing 7% and more in prevention and diversion. So to me, that's too small to tell probably still, but it shows a shift towards interventions that we know are desperately needed. And supportive housing is probably one of the things that we need most in Ontario and across communities to support people with more complex needs who unfortunately in many instances have been experiencing homelessness for multiple years. So to me, that shows a little bit of a system correction. It'll be important to see how that proceeds. Housing spending, we see a smaller portion over time on community housing, rent geared to income. No one is building rent geared to income, so that's likely why we're seeing that. So then we're seeing that shift more into other forms of housing here. So affordable housing, which is kind of a catch-all for a few different things, and into rent supplements. And I know in Ontario, service managers are kind of divided on whether rent supplements are a viable option given their community, given their rental market. However, we are seeing a shift towards that for those private rental markets that can bear rent supplements as a solution. Okay, looking ahead, these are the projections we developed under the new economic pressures. I'll do my best to explain this. I'm not a data scientist, so any more technical questions we can get the technical folks to answer in future. But what we wanted to do is we used the exact same model as last year, the linear regression model. We didn't change that. What we changed were some of the assumptions. So we still looked at 3 economic scenarios. We updated it with the more current data that we had from 2024 and 25. And then we modified a few of the assumptions, which can be found in the technical appendix. So what we see is still nearly 3,000 people expected to experience homelessness in the downturn, 177 and a half under steady, and 128,265 throughout the year in an upturn. What's notable here is even if the economy improves, homelessness trajectory does not reverse. So the economy is not a silver bullet for us to reverse the trajectory of homelessness, and it's not simply economic circumstances that are driving on a one-to-one with driving the increase. Things we changed as we presumed in this assumption based on the research that employment will go up further than we had thought it previously. That median income will go down with more stagnant productivity and limited wage growth. The core housing need will rise. That will be driven by supply shortages, weak income support, systematic barriers. That's a really important one because core housing need was artificially was deflated in 2021. That was in part due to the COVID payments. And so how's the core housing need looked better in 2021 than it did in 2016 for many communities. So our assumption here is that that core housing need in this year's census will escalate beyond what we anticipated from 2021. And then affordable, we also assumed affordable shelter costs will fall relative to market rents and deepen the affordability gap. Quickly go over this again because I don't want it misconstrued. What I'm about to say in the discussion is investment is essential. Investment is essential. We need investment in deeply affordable supportive housing prevention. You will never catch me saying anything different. However, it's worth discussing within this context of we've seen homelessness increasing by 49.1% over since 2021. And in the same period, the funding has increased 32.1%. It's help seekers hypothesis and kind of beyond the extension of the report now to discussing sort of our opinion that given that trajectory that we're on and the increase that we're facing in Ontario, but frankly in other provinces, that no single level of government will be able to spend out of this issue without parallel social infrastructure reform. So how might we pair housing investment, deeply affordable investment, with social infrastructure reform so that we can change the conditions under which all of this is operating? So I'm not just talking about Ontario here. We're going to go a little bit broader. But one of the things that struck me when writing the report was our use of the term crisis. So my background's in housing and homelessness, and I've been using the term crisis since I started. I can trace it back to just after World War II. In American media, homelessness was referred to as a crisis. You started to see that popped up. We've used that terminology as crisis since the end of World War II, all through 2018 and 2021, when homelessness was crisis but stable. So it is a crisis for people experiencing homelessness and for communities and families and the people who are supporting people on the front line, but it is not, in the strictest sense of the word, a crisis. It is not an emergency and is not a temporary or episodic event. And I'm not saying it's because it's not urgent, it's incredibly urgent, but it's a predictable systems outcome under the current conditions that we've created. It's a modeled and repeatable outcome of how the system operates. Yet, because we are in crisis operation and municipalities and service providers and frankly all levels of government, we are using instruments of crisis and emergency rather than some of the upstream tools that we need to make available to us to improve homelessness. So housing, health, justice, disability supports, early childhood education, and looking at how those systems interact over time. No question, housing availability and affordability are doing most of the work here and the lack thereof. So when there's not enough housing, when rents are moving faster than incomes, when more people will fall into homelessness and fewer are able to exit. And that's why we're seeing that chronic homelessness population increase. People are not staying homelessness because there's no services. There's nowhere for people to go. So problem number one, we don't solve that without looking at that. And as I was saying, the economic conditions do matter. They do impact the trajectory of homelessness and where we need to go. So changes in employment, inflation will all show up in the homelessness data. And that's part of the illustration we're trying to show in the modeling. But as I said, even when we change those economic conditions to frankly quite favorable, it's not enough to reverse the trajectory we are on. Perhaps if we were in 2018 and we were in 1920, a stable trend of homelessness, perhaps, but we're not. It's escalating as we go, particularly in places like the northern and rural Canada. So it's not a silver bullet. As well, it's not a silver bullet because economic improvements don't reach everyone. So as long as we have such significant inequities in our society and economic inequities in our society, an improving economy is not going to change the trajectory that we're currently on. The system is expanding. We are spending more, which again, investment is necessary, but we are doing so still in many ways as a crisis and emergency response. So expansion investment will support community safety, well-being, and basic functioning, but the conditions that drive homelessness haven't changed. And in fact, we are worsening many of those conditions through the lack of integration and looking at the social safety net as a whole. So numbers are rising, more people are becoming chronic homelessness, and the system, including everyone on this call, is working their asses off, working harder, but it's not producing overall stability because of those conditions underneath. As I mentioned, we've increased spending significantly across housing and homelessness, but that rising demand that we're seeing, more people on the wait list for community housing, more people with job loss, more pressure on housing affordability, that rising demand is absorbing that investment that we're making. So as more people enter the system and stay longer, the cost of homelessness per person also increases, certainly human cost, but also the financial cost. So that repeated system use becomes the norm. So higher spending is not going to stabilize the system conditions, and it will not reduce homelessness overall as we continue to sort of expand the necessary response today. But to me, and again, we are beyond the bounds of this report, but homelessness is not the only signal. Homelessness is the visible outcome of a poorly functioning social safety net. It's one outcome produced by the broader conditions of the economic and the socioeconomic and the social infrastructure choices that we're making. And we're seeing these same pressures show up elsewhere. So long waits to get health care, lack of mental health care access, pressure on emergency departments and hospitals, challenges securing or moving people to employment, huge unmet needs for seniors, caregivers, youth transitioning out of the child welfare system, strain on emergency justice systems. And so all of these same conditions are producing adverse outcomes in each of these portfolios, and we continue to spend in each of these portfolios in hopes that it'll come together. So what I'm saying, I think here is it's not a single program failure. We're investing heavily in each of these areas as we should be, but we're spending in a way that is managing the instability after it shows up. And homelessness is the easiest, in some ways, most visible consequence of that decision. When I looked at how governments across different provinces, and not just provincial governments, but municipal governments are kind of acting in the last 3, 4, 5 months, we can see evidence that there is recognition of that. I'm preaching to the converted in many ways. We have task forces, interministerial tables, cross-government committees, but integration at the planning advisory level is not the same thing as true social safety net reform or social infrastructure integration. And bringing ministries together at a table doesn't actually on its own change how money flows or how responsibilities are assigned. And historically, we've put all the focus on frontline service delivery to coordinate systems that are not coordinated from the top. So hospitals and shelters and the need to manage hospital discharge. That's a valiant effort. We need to do those things, coordinated access, but actually we need to do it from up above. I will say that New Brunswick, so one of the examples of New Brunswick, the Path Home, they have the Ministerial Homelessness Task Force, Housing, Social Development, Health, Public Safety, Local Government. It's a nod to the idea that there needs to be cross-portfolio integration. Quebec, sort of similar, did a national health prevention strategy in an effort to put health, mental health, social services under the same public health framework. But again, that advisory integration is not the same as social infrastructure integration. The thing I think, though, that may be different, otherwise we're just reorganizing deck chairs in the Titanic, is what may be different is the new fiscal context we're in. So although we've always had sort of this recognition of integration, 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 because of the reduction of public safety, or excuse me, the public service, more impetus for value for money, doing more with less. Again, that can be a kind of a policy, what's the word? That can be a bit of a blip as well. But anyways, there's more focus on that because that plus the increasing negative outcomes, those together might be enough that we might see an actual sort of push towards integration. Because I don't think the escalating homelessness or escalating negative outcomes in the community seems to have been enough for that large scale sort of systems reform. But when we couple it with fiscal pressures, I think there may be an opportunity to really look at how we're doing these things, both to improve outcomes, but also to improve overall spending. For us, and it mentioned in the report, but really what this takes is a whole of government approach. So true integration, and we can take it across all levels of government. I'm not just picking on provincial, is to decide that the outcomes across someone's whole life course are the responsibility of all ministries: health, justice, education, housing, community service. And you have to zipper up those operations, performance management, contract management, funding decisions, not just your intent, not just your advisory of how it should work. And so for us, that's really four things. It's integrating data. There's a ton of new innovation technology. We should be using that innovation technology to service those who most need it and improve outcomes. Integrating activities, again, at the very highest level, integrating funding so that we're effectively spending across each portfolio, and most importantly, integrating accountability so that the decisions that are made, the interventions that are made in the health system are understood and tracked in the homelessness outcomes, and then we're able to hold kind of all of our governments account to each of those. In our kind of last 20 minutes, just to mention, we did use housing and homelessness model for both reports. We actually have it available now for all communities. So regardless of province, regardless of level of government, we're really excited about that. We've made some new improvements with some AI innovation. So if you want to talk about how it works for your community, let me know. And before I go to the next webinar, I'm going to take questions. Okay. Do we have any questions, comments? Strongly held opinions. We like those too.
Jesse, I've got a question. Could out of the box thinking involve research into successful community developments under structured parameters? Some of the core issues of identity crisis or life purpose does not get addressed.
Say that again. Sorry, Taj, I'm like a bad auditory learner. Can you say that one more time?
Yeah, could out of the box thinking involve research into successful community developments under structured parameters?
Yes, and if I'm understanding the question correctly, I think so. Maybe if the person who wrote that could just maybe phrase it slightly differently for me, I'd appreciate it. I want to make sure I'm understanding.
Okay, we'll see if there's an update on that one. Another question is tools, tips, or tricks to help people to better understand that municipalities are doing everything they can and that the anger and calls for action need to be redirected to provincial and federal governments.
Yes, I actually have a controversial opinion. The public doesn't care and will never care. And if when we repeatedly say that's not my problem, or I'm not that's saying that's what we're saying, but we're saying, oh, there's other levels of government and the history of tribe governments and sort of the civics piece, I maybe cynically don't believe that that is ever going to be really effective. However, with the caveat, I did spend quite a bit of time reading Reddit and Facebook comments, God help us, after this release of this report, and I was encouraged to see sort of the balance of opinion and understanding that this really is a responsibility of in part provincial and federal government. So maybe I'm wrong, but I do think it's challenging because at the end of the day, people just want to feel safe. They want help for their families. They don't want to explain what an encampment is when they're walking their kids to school.
Next question, how are we sharing this with decision makers? Groups like Strong Mayors, along with decisions from the province, have directly impacted the realities on the ground and are not rooted in evidence.
Yeah, in Ontario, I am really looking forward to the municipal elections. And I think in part related to the last question, how we inform our candidates who are running for municipal elections and council is paramount, and their perspectives and understanding of once they're elected and how they bring that into to the sport of, pardon me, the next year 10-year housing and homelessness plan. So I really think one of the unfortunate responsibilities of service managers to work closely with their elected officials to ensure that they have the information they need to understand how this issue manifests and what types of things we need to be advocating for. And I know there's lots of service managers who do a great job of that. And of course, AMO and NOSDA and OMSA on the call do as well. Michael,
Will
feel
this
free to
webinar,
jump in, by the way, too. I'm in your backyard if you have any comments.
there's a question, will the webinar recording be shared afterwards? Yes, we will be sending that out after, so you
For
will.
better or for worse. But yes, you'll have
Yeah.
it.
Inbox. Yeah. Another question. Given that modeling shows homelessness remains a stable outcome even under improved economic conditions, what specific forms of cross-ministry accountability or integrated funding would actually be required to shift the system out of this equilibrium rather than just expanding its capacity to manage crisis?
Yep. What I would do is I would go into provincial government. I would take all of the person level data. I would link it across health, disability, homelessness, housing, as much as you could link it. And I would look at the people the cohort with the most negative outcomes. And I would look at what are those interactions that are driving costs. And I would lock everybody in a room and say, for these people, what types of interventions or spend or matching might improve their circumstance. And I would go through the entire population, one cohort at a time. And I'm not being facetious. I truly think we need to use the technology and data that's available to us to better understand who exactly is experiencing what, when, the journey across their life course, and how we might be able to match at a hyper specific level people who are not doing well, we're not serving well with the social infrastructure.
Okay. Given that the modeling shows homelessness remains a stable outcome even under improved economic conditions, I
I
think I
think
read
we,
this
I
already.
think
Yeah,
yeah.
just did that one, sorry. The next one is thank you for providing data to support what many municipalities are feeling. Do you have suggestions for how we can advocate for the types of changes that need to happen at other levels of government so that these real system changes can happen?
Yes, I would say fair or not, which is a matter of opinion. We need to acknowledge the current fiscal and operating constraint that the governments are working in, all governments, and we need to present solutions and ideas and evidence that are based in business and fiscal responsibility and why these certain types of interventions are a better cost path. And unfortunately, I don't think there's another way, or there's not going to be openness in any province to having some of these conversations if we're not able to make a business case in addition to the social and human case for these decisions.
Could you please speak a bit more to how program rules and scopes are being refined? For example, eligibility criteria, intake rules, or service mandates being adjusted to respond to pressure points. Are there any specific reports or program overviews that you could point to that address this shift in further detail?
Yeah. So what I can share with you, I did a review, an AI assisted review of that actually very question in each of the provinces. So after this, I'm happy to pull it together into a little blog and I'll show you some of the examples. But as you know, that happens every day. Every day there are changes in those micro program level expectations, not just Ontario, I mean elsewhere. But let me pull that together for you and we can send that in a follow-up email.
Next question, did you get better understanding as to why enforcement measures within the context of the Waterloo decision is dispersing and note reducing homelessness? For example, you have to provide an offer of indoor space that truly meets the individual's needs.
Mhm. That was, while maintaining confidentiality, that was referenced in some of the comments we received from service managers in that encampments really hadn't changed in numbers or in composition, largely because they have zero indoor space to offer to be able to do so. So that did come up tangentially within the comments, but beyond that, we didn't delve into that deeper.
Next question. Does this research help debunk the migration myth that people move to other cities to get better homelessness services? It seems like the movement is financial, people falling out of financial stability rather than geographic movement.
Yes, and when you do it at, it doesn't explain the Ontario levels unless everybody's coming from Manitoba or everybody's coming from Quebec. There's not enough buses. And so, yes, I do think what the data certainly supports that this is an issue within the province and not simply people coming from everywhere else.
Given the research published this month, designed to fail, in quotes, confirming what we all know about the impact of income levels and housing affordability specific to Ontario Works/ODSP, how can we effectively advocate for changes to social assistance and living wages?
Yeah, and I'm not an expert. Of course, Maitri is an expert, so I don't want to get over my skis. Expert in social assistance. Certainly, that has an impact on how many people are homeless and your ability to exit homelessness. I think we need to apply the same rigor to that portfolio that Maitri does as well, and thinking about what is the overall cost argument when we talk about that kind of data integration. I said the cost argument for increasing social assistance and how does that overall improve outcomes across the life course and therefore spending within the social safety net. And that doesn't need to be all of the conversation, but certainly I think that would help drive part of that conversation forward.
Next question. You mentioned earlier this is not a crisis, but a predictable outcome, and yet we are using crisis. Could you say that again, please?
Yeah, and I don't want to pick on wording and communication and semantics because at the end of the day, 85,000 people experiencing homelessness, I get it. It's a crisis. But when we continuously refer to something as a crisis rather than a predictable condition of the choices we make across the social infrastructure, a modeled condition that a model can predict, I think it lends ourselves to focusing on those same types of responses, so emergency and crisis responses. Whereas this is not temporary, and I don't think we can get ourselves out of it just through the homelessness and housing system. And there's no amount of performance we can squeeze out of a homelessness and housing system without looking at some of those upstream conditions and, frankly, a wholesale reform of the social infrastructure. But
Have you
don't get me wrong, I absolutely believe it is a crisis for individuals and families.
have you measured other costs municipalities contribute to manage homelessness by law enforcement,
Hmm.
fire response and inspections, parks remediation, etc.? I think the spending towards the issue is higher than discussed.
Yeah, I would agree with you. We've done previous work on social impact audits to look at the total spending into a community's social safety net by all levels of government across all issues, not just housing and homelessness. And I 100% agree. There's bylaw, there's other staffing costs. So yes, I would say this would be an underestimate. And in fairness, it would be an underestimate across all levels of government, but certainly municipalities.
Have rent caps been modeled?
No. No, no. Between there are other things. I relied on COVID. There are lots of other things that happened from 2021 to 2025 that may also be drivers of homelessness. So of course, rent caps could be one of them. We did not do that. We have not investigated that kind of in a mathematically sound way.
Does your research support Greg Colburn's position that homelessness rates across communities are primarily explained by housing costs or housing/income ratio?
I don't know. I don't know. I'm not actually familiar with that. I would please send it to me in my emails on the screen. I would love to look at that. And I would be remiss to kind of suggest what this research does or doesn't support. it is of my own personal opinion that it is not simply housing costs that is driving escalations in homelessness across the country. But I would love to have that discussion.
Are you able to share any insight around what front-loading investments to organizations for frontline service delivery does without supporting their back-end infrastructure in terms of perpetuating systems that aren't able to work in a more coordinated manner? For example, there's often large investments to frontline service delivery initiatives, but disproportionate amounts to overhead costs, which leaves organizations in reactive mode, responding to greater issues with either the same or regressing infrastructure to support that work. I wonder if
Mhm.
money into that front end without restructuring how the nonprofit sector operates as a system may be contributing to some of these challenges as well. What are your thoughts?
Yeah, I think that's a really interesting thought. And again, outside the bounds of this research, but that's an issue that's not just happening at a nonprofit service delivery level. It is also happening at a municipal level, right? We have municipalities who actually don't have the administrative funding and the back room support in order to kind of really bolster the system on the front, even if they get new funding. So that's something I've heard. Part of that is also caused by a lack of disorganized or a lack of organization upstream from other levels of government. So it requires more administration and more backroom support to support 10 different systems that are not operating as one than it does if we had greater uh, clarity at other levels of government organization. But absolutely, yes, I think it's a factor. To what level of how much do we fund this versus this? And I don't know.
Any ideas of how we support people working in the sector or people supporting folks who are experiencing homelessness? It feels that locally it's become an easy target for bullying, harassment, and abuse for staff, volunteers, and of course, people experiencing homelessness.
Yeah, I think during COVID, what we saw in some media analysis was a public reckoning of homelessness that should be addressed and a public sympathy. Like any issue, public sympathy runs its course and it turns into NIMBYism and discrimination and exclusion and stigma. And as people get more fed up with the outcomes they're seeing, whether that should be directed at municipalities, provincial government, federal government, those unfortunately, that rhetoric is taken out on people who uh, need support. I think it was particularly unfairly and in some ways in racist connotations taken out on refugees as well who are seeking asylum here. So um, I don't know what the answer is. I won't pretend to know the answer, but I do think it's an escalating concern. I hope that that same judgment people are using is the same judgment they use to elect informed councillors in the municipal elections to participate in local government. But again, I don't know.
In Austin, Texas, there was a community first village where apparently some 1,900 people are being housed.
Hmm.
Much money was donated as this is a private venture. Could public-private ventures be considered?
Yeah, I'm biased here. My background's in corporate social responsibility. I think there's a ton of money in corporate, but corporate money, corporate social responsibility money is spent with business interests first. And it is not spent with social interests first. It doesn't matter what the company is. There's always a business aspect to it. So I think part of it is making that case. And I know there are municipalities pursuing some of that private partnership, and it's um, the tools that we need to kind of work on to do that need to be improved. But again, I don't think it's a silver bullet, but absolutely.
Could you go back to the page referring to Indigenous unhoused individuals?
You
I
bet.
missed it and would like to hear
Sorry.
it
Sorry
again.
for scrolling, folks. And we have 1 minute left, but this is a good issue to end on. Here, was there a specific question? I just want to make sure you're able to see
No,
it.
it just says I missed it and would love to hear it again.
Yep. So last year, I felt that our Indigenous homelessness were an underrepresentation because we use known homelessness. And so known homelessness is that you're known to a service manager or a DSAP. And there's many reasons why Indigenous people may not touch the system at all, or if they do, may not disclose due to discrimination or racism that they are Indigenous. So I felt like this was an underrepresentation. Further, we are not, unless a person is known to the system, we're not counting them. So people on First Nations, membership of First Nations who don't use services connected to DSUBs or service managers also would not be represented in this data. So I believe it's increasing, and that's not simply a function of better data collection, as well as it's an underrepresentation of the true extent of the issue.
Okay, awesome. That's all the questions.
I think we'll end on there. Folks, I really appreciate it. And thank you to AMO and NOSDA and OMSA and Michael. Thank you for joining the conversation today. Oh, join our next webinar. Social safety net designing technology and data collection specifically for social infrastructure organizations and the difference that will make and related to a lot of what we've spoken about today. Thank you so much. You can register. We'll send you the link.